Hello, good evening, viewers in Nigeria and around the world. You are welcome to Talk Here with Dr. Laz, your favorite health program on television. Of course, as usual, we are reaching you from your TV channel of choice, the Africa Independent Television, AIT. My name is Dr. Laz Eze. Tomorrow is 25th November and is an international day, and it's a special day that we use to raise awareness on issues related to violence against women. So it's International Day to End Violence Against Women. And it's also day one of the 16 days of action on gender-based violence. So every year from 25th November till like 10th December, 16 days, there's high-level advocacy around the world on issues on gender-based violence. Of course, gender-based violence is a type of violence that is perpetrated against persons based on their gender. It affects both males and females, but evidence shows that women are more affected by gender-based violence. And that's why a lot of times there appear to be more attention on violence against women. According to the United Nations, 1 out of every 3 women have suffered physical or sexual violence from someone that is close to them, an intimate person. And evidence shows that in 2020, this number has gone up, especially during the COVID-19 lockdown. So it's something we must do something about. Of course, we already have the legislative framework for tackling this here in Nigeria, the Violence Against Persons Prohibition Act, which was passed in 2015, after 13 good years at the National Assembly. You heard me right, 13 years before the VAB Act was passed. As if 13 is a special number that has to do with the Act, only 13 states between 2015 and now have domesticated it. So it took 13 years to pass the Act. As we speak, only 13 states. But talking about the Violence Against Persons Prohibition Act is not just a social issue, but it's not also just a human rights issue, but it's also an issue of public health importance when you talk about violence against persons. So in other words, you can say that the VAB Act is a public health law. Another type of public health law is the National Health Act, which took 10 years before it was passed. Of course, of recent, we had the Infectious Disease Control Bill, which became very much controversial, which is also another type of public health law. So I've moved from the International Day on Violence Against Women to talk about public health law. And that's what today's program is going to be focusing on. So I'm going to have an expert on health laws and a policy expert who is going to join me in the studio to talk about the characteristics of the public health law, of an effective public health law. So we are going to be looking at issues. Why does it take too long to have a public health law passed? Why is it that when it's passed, sometimes it takes long before it's implemented? Why is it that even when it's implemented, it's not effective? Nigerians can't really see much changes as a result of the law. So we're going to be talking about this. And also in the course of the program, I'm going to play a conversation I had with the African Union ECOSOC-Nigeria, the head of Gender and Women Affairs, Adaora Onyechere, who also spoke on issues around violence against women. So continue to follow us on our social media handles at Talk Health Nigeria, whether it's on Twitter, Facebook, or Instagram, or subscribe to Talk Health Nigeria TV on YouTube so that anytime we post things, you can always get notifications and get to watch us and follow up. So we'll take a short break and we'll be right back. And when we come back, I'm going to introduce my guest and we deep dive and get into the conversation proper. Thanks. Don't go anywhere. Please stay with us. Welcome back to Talking Here with Dr. Laz, your favorite health program on television. Before the break, I told you we are going to be discussing something very important about public health laws. In fact, specifically, public health emergency laws. COVID-19 is here with us in 2020, and second wave is moving around the world, and everybody needs a strong legislative and policy framework, to tackle it. And with me here today in the studio is Dr. Cheluchi Onyemelukwe. You're welcome to the program.
Thank you very much.
Dr. Onyemelukwe is an expert in public health, in fact, anything that has to do with health laws and policy. She's also the managing partner at Health Ethics and Law Consulting.
Yeah.
She's an associate professor, I think, Barker University.
Yes.
And consultant or legal consultant to resolve projects.
Yes.
She wears many hats. You're welcome to the program.
Thank you very much, Dr. Laz.
We have 12 identified characteristics of effective public health emergency laws, and we have less than 20 minutes to talk about this in such a way that our viewers are going to understand it. So perhaps let's start from way of introduction. In the midst of COVID-19 and public health laws, what relevance does it have to do? Bearing in mind the controversies of the last few months on infectious disease bill.
Yeah, thank you very much for having me, Dr. Laz. I think that's a very important question and a very relevant one at this time. People have asked me before, what relevance does law have for public health? But we know, at least the minimum that we know is that during COVID-19, our movement was restricted. We were told there's a curfew and so on and so forth. So in a bid to enforce public health measures, the best way in a democracy, in a place that is, in a country that is trying to ensure that the rule of law is what guides all actions, you have to have a legal framework that allows you to implement those public health measures. Okay, so that's just very briefly. But even beyond COVID-19, right? So, for example, we have National Public Health Institute, the NCDC, for example. You need a legal framework to establish it on a firm ground.
And of course, NCDC also attends to meningitis, Lassa fever, cholera outbreak, yellow fever, and so many of them, which are public health emergencies.
Which are public health emergencies, or maybe on hopefully a lower scale, a smaller scale. But you need to ensure that all of those routine surveillance and all of that are embedded within a legal framework. So public health law is something that protects the public as well as gives the government the power and the authority to implement measures to protect the public's health. Yes.
Right. So we get to those 12 characteristics very quickly.
Yeah.
And the first one, it says, address complete life cycle of emergencies.
Yeah.
Can you speak to that?
Okay. If you'll permit me, just before I speak to that, maybe I'll tell you how the 12 characteristics came
about. That would be great.
Because we haven't really had that in place before now. So Resolve to Save Lives, an initiative of Vital Strategies, during COVID-19, they had been doing quite a bit of work on legal preparedness around the world, including in Nigeria. It became very clear very quickly that as countries were grappling with this, they needed to also do something to address their public health emergency laws. And so just looking at the best practices around the world, they came up with these 12 characteristics, having looked at various countries, various jurisdictions, trying to determine. It just happened this year? Yes, just a couple of months ago. And came up with these 12 characteristics to help all countries, developed and developing, wherever you are in your legal preparedness, to develop something, to look at these characteristics as you go forward. You talked about the controversies, for example. Perhaps if we had this, that would, would have been able to address that more effectively. But that's the whole point, that you look at these 12 characteristics and then you contextualize them and make sure that they are well identified within your system. Now, in terms of what you mentioned, the whole life cycle, when a pandemic or even just a small, quote unquote, epidemic
any public health
begins,
emergency.
any public health emergency begins, there's a period, there are some things that will happen in the beginning, and you really need to be able to have a framework that addresses how it commences, with the public health measures that you apply, how you begin to taper off the public health measures, because those public health measures may affect other aspects of life, economy.
That's very right.
Movement.
We really need to get into these characteristics because before we know it, our time is up.
It's up,
Yes, so you've provided a very strong background.
Yeah.
So, and like I mentioned earlier, the first one, I really like the fact that you provided that background on how it came about. So the first one on address complete life cycle of emergencies. So any public health emergency law must address those life cycles, right? Do you want
from
to
the
add something to it?
From the beginning to the end. How do you end it? How does it begin? How does it end?
Okay.
And so on. How do you taper it off so that you're not using the same hard measures in the beginning that you use towards the end?
Okay.
And so on.
So like in COVID-19,
this is how it's going to end. These are the issues that we address towards the ending. All of that needs to be addressed in an effective public health emergency law.
Okay. So the law also has to define the triggering events.
Absolutely.
So what are those events that brought about the emergency?
Exactly. So sometimes, if you look at our constitution, for example, it allows the president to do certain things when there's an emergency. It tells you, it helps you define what an emergency even is. So your public health law, emergency law, has to say this is what a public health emergency is.
Okay.
All right. Otherwise, you can have that heavy-handed approach at any given time. So you say this is the triggering event. This is how it gets triggered. This is our definition of public health emergency, and this is who has the authority to say, now we have a public health emergency. Now these are the measures we're taking.
Okay, we'll move to number 3.
Yeah.
So balance strong and agile decision making with meaningful oversight.
Yeah.
And in this case, to talk about the various institutions that have to provide those oversight. So how do we strike the balance?
So that's exactly what that is, that you have to strike that balance between having certain routine bureaucracy and knowing when to move. Again, it's all about triggers. What kind? When do you trigger the use of emergency funds, for example? When do you have a particular authority be able to do certain things without having to go through normal channels? These are some of the kinds of things.
So it wants us to cut off certain bureaucracies.
Absolutely.
Because of the urgency
of the situation. Yes.
Okay, so we'll move to number 4 that says fund adequately.
Yes.
But before you go into that, I want to highlight something that got me trouble. I even had to tweet about it some weeks ago.
Okay.
The NCDC Establishment Act provided for 2.5% of the basic healthcare provision fund meant for emergencies, as provided by the National Health Act 2014. But the implementation guidelines for the basic healthcare provision fund was reviewed this year, and that 2.5% was taken out during a period that we are managing a pandemic, so a public health emergency period. What are your thoughts on that?
Thank you for bringing that up. I think that is particularly relevant for our situation in Nigeria. Obviously, there's a bit of confusion as to why that was. The National Health Act itself makes certain provisions around those basic healthcare provision fund, and I think there has been a confusion. But it would seem to me that this is something that we can remedy quite quickly.
Okay. From the legal perspective, do you think is the right thing to do?
From any perspective, legal, practical, I think that we definitely need a fund for emergencies. If nothing else, COVID-19 has taught us that. You could, if you don't have such a fund and the pandemic or an emergency comes and meets you, you're in deep trouble.
We're in deep trouble. And now we are even in a recession.
And you're in a recession. So you need that standing fund. You need that standing fund. And the hope is that perhaps the National Health Act itself will be reviewed, and this anomaly, as it were, would be addressed.
Well, there's divergent views on the review of National Health.
Health
Some
Act.
persons argue that the act has not even been well implemented,
Yes.
let alone having to start revising it. But I'm aware that National Assembly appears to have started efforts. We'll take a very short break, and when we return, we're going to take the remaining in a very fast style because we don't quite have time. Take the remaining 8 characteristics of public health, effective public health emergency laws. Do stay with us. We'll be right back shortly. Welcome back to Talking with Dr. Laz, your favorite health program on television. I'll be discussing with Dr. Cheluchi Onyemelukwe, who is a health law expert, a policy expert, and wears so many other hats that if we start talking about it, our program will take a lot of time. So we've mentioned like 4 characteristics, and we just have like 5 minutes to kind of mention the other 8, and I'll quickly run through them. Equip authorities with all relevant public health tools. He's talking about both national, subnational levels, and all this. So what could those tools be? The relevant public health tools that must have. Of course, tools are not just physical things and all that. I guess it should also include monitoring and evaluation, surveillance tools.
Yes, surveillance tools, even capacity building tools, well, these are routine tools that need to be used during periods of peace. But these are also the tools that help us realize immediately that there is an emergency. So
So number 6, fulfill international health regulations obligations, IHR obligation. And I think that's also part of, during the briefing by the Presidential Task Force yesterday, the chairman, the SGF, NCDC, DG, and all that, were expressing concerns around issues that has to do with COVID-19 testings and how people were trying to cut corners and things like that. So such laws has to, ensure that those regulations are met. Please, if you're watching this and you know any legislator, I think that you need to bring the person closer to television, because this information, whether it's a House of Assembly or House of Rep or a senator, is really relevant for the work they are doing and the work they will still do in strengthening our public health laws. So protect human rights. This was a major issue during the lockdown.
Okay, so usually people think about public health and they think that we have to throw human rights away. And the truth is that we don't. There are certain human rights that are non-derogable. The right to fair hearing, the right to life, amongst others, are non-derogable even by the provisions of Section 45 of our Constitution. And therefore, we have to protect human rights as much as possible.
Protect those rights.
As much as possible within a public health emergency context.
Okay. So number 8, integrate functioning health strategies. So every of such law has to integrate that. Number 9, ensure flow of health data across all levels of governance. I love data. And without data, you can't really make certain crucial decisions. And I think the NCDC and the Presidential Task Force, deserve credit on how they make data public on daily basis. But we are talking about the laws. This should apply on any public health emergency at any level.
Absolutely.
State and local government inclusive. Number 10, safeguard healthcare workers.
So we have to ensure that public health emergency laws provide for things like PPE, which we talked about.
Personal protection
equipment to protect them as they do the work of protecting us. But also even things like hazard pay. Giving them a little compensation. It's never enough anyway for the work that they're doing in being the frontliners in the war that we're fighting against pandemics and epidemics.
That sounds good. It was a major issue by the resident doctors, Joint Health Sector Union, and just a couple of days ago, I saw on social media a candlelight procession of a 32-year-old medical doctor who possibly got COVID from a patient and lost his life.
Yes.
You know, so it's really very important for these laws
to protect,
to prioritize. You know, many health workers died from Lassa fever.
Yes.
Doctors, as at 1st April this year, 6 medical doctors were lost to Lassa fever. You know, and that shouldn't be. Okay, number 11, enforce the rules without imposing unjust penalties.
Yes.
You know, Nigerians wish that we have time to
really
dissect into each of these points. And let me quickly say the 12th one so that we could round it up very quickly. Promote transparency.
Yes.
So every public health law has to do all this.
To promote transparency. We've talked about health data and all of that, but also to promote information, because misinformation makes people not want to comply. If we're transparent, of course, people are more likely to put their confidence and their trust in the government of the day and to say, okay, we will comply with the measures. So you need to protect whistleblowers. You need to be able to support information going out, and that's what you have in number 12.
Okay, that's 12. We've been talking about the 12 characteristics of effective public health emergency laws. And our guest, who is an expert in public health laws, you are a lawyer or a medical doctor?
I'm a lawyer. I'm a
Great.
lawyer. I have a PhD in law. Yeah.
You know, so because, you know, on this program where we use doctor, everybody assumes is a, you know, so she's a lawyer and she's an associate professor for that matter. We really thank you for coming on this program to talk about this, and we hope that our lawmakers across the country, you know, are going to, you know, ensure that going forward, any type of public health law gets to take into consideration, you know, all this. Perhaps, like you said, is going to help to eliminate the controversies that greeted, like the type we saw with the Infectious Disease Control Act. Thank you, Dr. Cheluchi, for being on, for talking health with me.
Thank you so much for having me, Dr.
I'll talk law with you.
Yes, thank you so very much for having me on.
All right. Still on the program, just on the concluding part, I'm going to play a video shortly of the voice of the AU African Union ECOSOC Head of Women and Gender Affairs. You know, like I told you at the beginning of the program, tomorrow is International Day on Violence Against Women, and also day 1 of the 16 days of activism against gender-based violence. Adaora Onyechere is a broadcast journalist, and she is AU ECOSOC personnel in Nigeria. Let's hear what she has to say on this.
All right. First of all, I would like to say that when you talk about the 16 days of activism, which begins on 25th of November till about the 10th of December, which also happens to be the World Human Rights Day, it's quite significant for us here in Nigeria, especially under the African Union ECOSOC-Nigeria. I say that instructively because for us at the African Union, going by the conversation on conflict resolution, mediation and peace building, it is one conversation that has continued to take generic conversation across board, especially at the African Union. In 2013, to be precise, the African Union leaders came together at the head office in Ethiopia to look at the commemoration of the 50th anniversary of the African Union, and also look at issues concerning African countries. And I think that one of the conversations that came out of that anniversary was not just the pomp and gallantry. I think one of the most instructive conversation there was the fact that the chairperson of the African Union Commission, Nkosazana Dlamini Zuma, who had also discussed quite, widely with African leaders, visited African countries to look at one of the issues that were very, prominent, and that was conflict. And in order to look at the issue of resolving conflict, one of the adoption during that assembly was to look at a program and a project that would look at helping to reduce or in fact end conflict in African countries to be able to aid development across Africa by 2020. And that was in 2013. And that program and that campaign was called Silencing the Guns. And so when you look at silencing the guns, I mean, it's very instructive for us here in Nigeria as well as other parts of Africa, but for us more instructive because of the issues of conflict, community violence, and ethnic clashes that we have heard, from Boko Haram to Southern Kaduna crisis to issues of violence against women, even in public spaces like rape. I know that this year's 16 days of activism, the UN Unite campaign is looking at Orange the World, fund, respond, prevent, and collect. And talking about rape, we are coming into a time in Nigeria, that during the COVID period, especially during the COVID pandemic, where the issue of violence against women and girl children were highly on the increase. We saw a lot of domestic violence, and of course the case of Owa and Barakat seems to also never will wither in our memories, because that was what gave the clarion call to how and why we must end violence against women right now in Nigeria.
Welcome back to Talk Here with Dr. Laz, your favorite health program on television. That's the much we can take today. Thank you, Dr. Cheluchi Onyemelukwe, for being on the program, and also thank you, Adaora Onyechere, and thank you, our viewers in Nigeria and around the world, for tuning into this program. Please keep following us on social media handles displayed on your screen, as well as our YouTube channel, where you can also watch this program as many times as you like, as any day. Same station, same time next week. I remain Dr. Laz Eze. Bye for now.